Normally, brain gets its all blood supply from the heart through a blood carrying tubes known as a blood vessels. An aneurysm is nothing but a swollen blood vessel inside the brain. Generally, these swellings gradually increases over the period of the time, and at one point it ruptures, leading to the brain hemorrhage or bleeding inside the brain. Commonest risk factors for the brain aneurysm are cigarette smoking, high blood pressure, especially when it is uncontrolled, and family history of the brain aneurysm. That means close relatives of the patient, they have had brain aneurysm during their lifetime. Typically, this patient present with severe headache, which often they describe it as a worst headache during their lifetime. This is generally accompanied by vomiting, neck pain, abnormal body movements, which is also known as a seizures, and patient might come to the hospital in unresponsive state. If the patient present with typical symptoms of brain aneurysm, a surgeon generally advises for the CT scan of the brain to look for the brain hemorrhage, following which a DSA or the brain angiogram is always advisable to look for the presence of the brain aneurysm as well as to plan for the further treatment. Now the treatments of the brain aneurysm are generally divided into two categories. First, we have to decide whether the aneurysm has ruptured leading to brain hemorrhage or brain aneurysm is not ruptured. For the ruptured aneurysm, two forms of the treatments are there. One is known as a surgical clipping, another one is known as a endovascular coiling. One of the most advanced treatment in brain aneurysm is something known as a aneurysm coiling. In this procedure, multiple metallic coils are placed inside the brain aneurysm through the leg blood vessel without any need for open surgery. For unruptured aneurysm, treatment is generally decided on the basis of size of the aneurysm. If the size is small, we need a close follow-up with your neurosurgeon. If the size is large, patient still might need a surgery. Typically, the recovery of the patient is dependent on two factors. The first factor, the severity of the brain hemorrhage, whether it is mild or the severe, and second factor is how early surgery was done to close the aneurysm. If the patient has a severe hemorrhage, the recovery might take few weeks. If the patient has mild hemorrhage, recovery might take only 7 to 10 days.